We had an amazing year at the QE2 Foundation. Because of your generosity, we significantly advanced care for patients who come from across Atlantic Canada to visit the QE2. They are the reason we're here today. We measure ourselves not by the funds we raised, but by the impact we have on people's lives. And the last year was full of game changers. We built new facilities, which saw patients like Erin take her first step in the new Grace Hansen therapeutic pool. We funded life-changing technology and invested in research to find tomorrow's cures. But today is not really about us. Every moment celebrated was made possible by you. As donors, healthcare providers, and community champions, together you're changing and saving lives at the QE2. This is our year. This is your impact. Every year, thousands of lives are saved at the QE2. John is one. When he had emergency heart surgery, his life was in the hands of his care team.
It started out as a heaviness, and then from a heaviness it went to like a constricting, squeezing pain, and then from there it was like, I can't move. If I move, I'm going to pass out type thing. I was in the hospital for just about a month when they found out I was born with very small arteries in my heart that they said stents were probably going to be the best way for them to go. Stents are little tubes they put in your clogged arteries. They ran mine up through my wrist, put them in there, and they just chased all the veins and arteries up through and put them in my heart. It gave me back my life. I don't think for a minute, if I didn't go down when I was having pains, I don't think I would be here today. In little over a month, my daughter's getting married in Italy, and if not for the QE2, I probably wouldn't have been able to make that walk with her. So I'm eternally grateful.
In one short year, we raised $4.6 million through our From the Heart campaign. This campaign funded a state-of-the-art cath lab with cutting-edge imaging capabilities. We also funded new technology and research for cardiac and vascular care. Once again, you showed us philanthropy is at the heart of our community. Advancing care wouldn't be possible without research. You continue to invest in research so that those who come after you will live healthier lives. This year, you supported research in cancer care, transplantation, osteoarthritis, neurosurgery, and geriatric outcomes. You helped fund clinical trials and TRIC grants, which directly impact patient care.
Back pain is internationally the leading cause of disability in working age population. And we know it's an important health condition here in Nova Scotia as well. It's the most common disabling chronic disease in the province. At the QE2 emergency department, there are actually over 2,000 presentations for low back pain every year.
The QE2 Foundation TRIC grant allows us to do research that is very important to the research program of our department and for the care of our patients. You know, without money for research, you can't do quality research. And the research that we do, not just with the low back pain group, but in general, has results that are meaningful. It changes how we treat patients. It changes patients' experiences. What we're doing is going to make a difference, not just locally, but I think, you know, in how emergency medicine is practiced in Canada.
We have some of the best minds in medicine right here at the QE2. But to provide the best care to patients, healthcare providers need the best equipment. Last year, you helped fund technology that brings medication to the bedside faster, and anesthesia machines to monitor patients during surgery, as well as an EBS technology for targeted cancer treatment.
The hospital has a limited budget, but fundraising through things like Ride for Cancer, it's really made a difference. Last year, the goal was to raise enough money as a group to buy an EBS machine, which is a diagnostic piece of equipment for diagnosing lung cancers without an invasive lung biopsy. And a lot of times when you donate to causes, you don't see specifically where it goes to. You know, it's research, you know, it's cancer funding. But in this case, you know, you just see where it's going to, and that it will definitely be used within this area. And even though it's used here, we treat people from all over the Maritimes.
Last year, Ride for Cancer participants raised over $400,000 to help people like Charlene deliver even better care and improve treatment for those living with cancer. Events are really about impact. When we come together as a community, we change lives. Last year, we were part of the third annual Jordan Boyd Celebrity Hockey Challenge in support of inherited heart disease research. We saw community champions host a tournament for cancer research, and music fans supported leukemia patients. Katie was personally affected by funds raised through a special community event.
Strides for Obesity is a 3K fundraising walk that is done in October to help raise money for the Obesity Network. Fundraising to support the clinic means that more people will be able to be seen quicker. In order to help battle obesity, the earlier you can be seen, the better. The things that I've been able to do since having surgery is amazing. Prior, I couldn't even walk up a flight of stairs, and I'm planning to do a 5K next month. To somebody who donated, I would say thank you. You really are making a difference in somebody's life. It has definitely given me a longer life.
Beyond what they do every day for patients, sometimes healthcare providers become fundraisers. Marco is a fourth-year resident at the QE2 and is leading a team working to improve care for patients.
POCUS is something that myself and the residents and some of the staff members are passionate about, and we strongly believe that it does improve the care that's provided to the patients at the QE2. We really felt that this was something that we could do and we were actually obligated to do to help our patients. We've come together as a team to help raise funds, and what we'll be doing is running some races. The funds raised today will go directly to purchasing a point-of-care ultrasound machine for our medical teaching unit on 8.2 at the QE2. POCUS, or point-of-care ultrasound, brings the high-level technology that we have available right to the patient's bedside, and it allows the patient's own physician to make decisions very quickly and accurately. We've had support from various members from the QE2 and different residents and faculty that are all supportive of the project. So it's really nice to see that it's coming from a lot of different angles, and everyone is kind of coming together to move the campaign forward.
This is just a snapshot of the ways you are moving healthcare forward as donors, healthcare professionals, community champions, and friends of the Foundation. Thank you to our volunteer board of trustees. Your expertise guides us through every major decision and milestone. Our work is a reflection of your leadership. Thank you, every one of you, for supporting better healthcare. Together we raised $15.8 million to advance healthcare at the QE2. As a community, you are changing and saving lives. And we have bold aspirations. We're working with our partners to transform healthcare at the QE2. We're building a healthier future for you, your family, and our entire community. Together, we will make it happen. Thank you for your part in an amazing year.